Hey everyone, sorry we're a bit late today. It's Melissa speaking from Companion Animal Vets here in Dapto. I'm doing the handheld thing today. I hope it's not too wobbly, but I just wanted to talk about something that we're really passionate here about at Companion Animal Vets, and that's creating a fear-free environment and making sure that we treat animals in a way that gives them the least amount of anxiety and stress when they come to the vet clinic. And it means that we have a better working environment for us that work here, but also more importantly, obviously, is keeping our animals that are coming to the vet clinic as little stressed as possible. Lots of dogs and cats get anxious coming to the vet clinic. It's a really common form of anxiety, and some dogs that don't get anxiety anywhere else can be anxious at the vets, and same with the cats. So we're trying to run a practice in a way that produces as little stress as possible, as little anxiety. So coming to the vet clinic is not a stressful process for you to bring your pets here and not for your pets when they're here. So I just wanted to walk around our clinic and show you some of the things that we do. It might be a bit differently to some other places, and explain why we do them and how you can help you when you come in. So for one thing, I thought we'd walk from the front door, which is down there, into our clinic and just show you how we do things if you bring in a cat or a dog into our clinic. For one thing, I wanted to mention that nearly all of our staff are either have finished or are in the process thereof of doing their fear-free accreditation. It's about 10 hours of study run by a group in America, and it is it's a wonderful program, and it's a really good thing to get particularly the young nurses and things involved in a different way of dealing with animals and pets when we're handling them for the vet clinic. So when we talk about fear-free and decreasing anxiety and fear, anxiety and stress, we call it FAS, it's not just from what you see, it's actually how we deal with our patients all the way through our clinic. So whether you're there or not, this is how we deal with your pets. So it's really important that we do that. For our sake, we're actually having less problems with aggression, we're having less problems with anxiety. Animals respond better, they get better and healthier more quickly when they're not anxious. Animals that have had procedures or are having surgery or who are unwell are more likely to start eating more quickly if they're not anxious. So it's really important to us, all of this. So as we come into our reception area, we are just currently going through some changes where we're separating our dogs and our cats, trying to separate them pretty much completely. So if you're a cat person, we are setting up our upstairs consult room as our cat area. So the idea is that when you bring a cat into our clinic, that you actually don't put the cats anywhere near where dogs are going to be. We don't want our cats being put on the ground. We don't want them to be around other dogs. And we want them separate from other people as well, because often cats are anxious about other people as well. So when you come in with a cat, we'll know you're coming if you've got a consult, but our receptionist will take you straight up our stairs. So we'll walk in here. This is through to going past our beautiful cat playroom for our hotel, and coming through here into our waiting room. And we come through and we've got our lovely staff out here. And so this is our main waiting room area, as you can see. These are the stairs that go up to our cat room. If you have issues with walking upstairs, carrying your pets, we are very, very happy to, one of our receptionists will come and grab your cat, carry them upstairs. If you really can't go up the stairs for any medical reasons, obviously let us know and we'll organise a consult downstairs. So we're just trying to do it so that we can obviously there's going to be situations that are a little bit different, but for most of the situations it's really nice. And even this week I've had a few of our cat clients comment that their cats have been much less stressed by going upstairs, not having exposure to lots of people, lots of dogs while they're here, and they've been a much calmer consult, which is a really nice thing. It's nice feedback from people, so we really like that. But if you need any help, always ask. So this is now our dog waiting room. This is our dog waiting room area. If your dog is very anxious about other people and other dogs, we can actually take them straight through into this little area here, where we have another waiting room area here at the back where you can be. So we don't want your dog getting here and getting super excited and really freaking out. So if you're finding that you think your dog would be happier where they can't see other people and the traffic going by and all that sort of stuff, go straight into our waiting room area at the back there, and the nurses can come and see you. We can check you in on iPads and that sort of thing. So that'll all go really nicely. One of the steps obviously is recognising whether your dog's got an anxiety or is stressed in a situation, and there's a few signs that people don't actually realise. The really classic ones that we see all the time are things like panting a lot, licking their lips, so The lip licking is a really classic sign. And the other thing is yawning. And we'll often have people laughing saying, oh, it's not tired, you're not tired, because their dogs are yawning, and cats do it too. But it's actually a sign that they're quite anxious and quite stressed. So they're things that our staff will recognise. So if you're sitting out and you're watching your dog and then getting noticed, our nurses might come over to you and say, would you like to just come and wait in a consult room or out the back, because they'll notice that your pet's getting stressed. Don't feel bad, it's just that we're trying to help you. So that's our waiting room area now. We have 3 consult rooms down the bottom, and these are our dog consult rooms mainly. Obviously, as I said, there might be slightly different situations, but a really cool thing is we have a scale here for our dogs. At our set of scales, there is always treats. So these are squirts that you can put onto lollipop sticks. We've got treats in here. We've got greenies. We've also got some bandanas there. So if you think your dog is anxious, we can spray it with some Adaptil spray, which is a pheromone spray, and it can help your dog by putting a bandana while they're waiting, particularly if there's a bit of a wait, which we apologise for. And that can be helpful. But we want our pets to like coming to the vet clinic, and we want them to like coming in and getting weighed, because sometimes it's really difficult to weigh some dogs. And if we can make it a good experience, you can even wipe the food on this glass plate here, and they can lick that off while you're weighing them on the wall, so that can be helpful as well. Our dog areas are our consult room is in here, and in our consult rooms we also have lots and lots of treats. As you can see up the top there, we've also got Adaptil for the Adaptil spray as well, which we can use on ourselves and in our room to help calm and keep the dogs calm and quiet. So that's a little bit about Fear Free. We do a lot of it out the back. As I said, it's not just about what you see and where you experience it. It's also absolutely passionate about it in our treatment areas, in our recovery areas, where we handle animals in a certain way that we tend to not use very many muzzles anymore. We wrap cats up in blankets. We don't scruff them. There's lots of different options. And if you want to talk to any of our staff about it, we're very happy to talk about it. Hope that's been helpful. And we're going to do, I think there's World Cat Day, and we're going to go through all our changes for the cat wards and our cat hotel and everything at that point in time. Okay, see you later. Bye.